name, please?
Oh, hello, Dr. Atse.
Hello, Mrs. Pace. How are you today?
Oh, not so good. It's the menopause. I'm having trouble sleeping. The hot flushes are getting unbearable now.
I'm really sorry to hear this, but I'm sure we can do something about it. Hi beautifuls, welcome back to my channel. This is Voice of a Doctor and it's me, Dr. Atse. I want to welcome you back to another Saturday, the continuation part of Menopause Part 2. If this is your first time joining us, I would advise you to go back to the trailer channel as well as the part 1 of Menopause. Don't miss out. A lot has been said there that you would definitely gain from. So I want to thank you for your feedback. I want to thank every one of you who have sent in your words of encouragement, who have sent in questions. I have a few questions here that I would quickly want to address before I go to the treatment path. So the first question was from Ellie. Ellie asked if it was possible for a woman in menopause to have children. She also wanted to know if spotting for a day can be taken as a period. Well, the truth is, I just want to refresh on the definition I said to you about menopause. Now, there are two age groups. You have people over the age of 50 and you have people less than 50 years of age. Now, if you are less than 50 years of age, then you would need to have 2 consecutive years of no period at all before you can say you are in menopause. Likewise, if you're over the age of 50, then 1 whole year of no period at all before you can say that you are in menopause. Now, if you don't have such a time of 2 consecutive year, beg your pardon, and 1 consecutive year that is dry, then I would advise you to continue with your contraception or birth control pills because you could still be pregnant. That would be a time I would define as perimenopausal, and at such a time your eggs can still be a bit fertile and could still be releasing eggs, right? The ovary could still be releasing eggs, and so such a woman could still be fertile. So right now I'm just going to go through the treatment of menopause. In order to do that, I would quickly need to go through the symptoms with you. Like you saw Madam Pace earlier, her main concern was that of hot flushes, okay? And so the treatment really depends on that very symptom that is that you're struggling with. Okay, so again, the short-term symptoms of menopause would be that of hot flushes, sweats, poor sleep, headache, palpitations, feeling tired, being irritable, mood swing, body aches and pain, loss of sexual urge, and being tired. And then we have the long-term changes that then comes on with skin changes, loss of hair, and so the woman tends to lose the hair. Hair is thinning out, and then people are going bald again because of the hormones I said to you earlier on, estrogen, progesterone, that is slowly declining. And then there is atrophic changes, and this means thinning and drying out of the genital areas. Also, the bone would have symptoms like weakening of the bone, and so the quality of the bone is slowly deteriorating, and as such the bone becomes brittle. Now that I have quickly gone through these symptoms, so how do we treat it? So the treatment basically is based on 2 things. We have conservative measures, we have medical measures that are non-hormonal, and then we have the hormonal treatments. So what are the conservative measures? These are simple things that one could do. For Madam Pace, for example, she talked about hot and unable to sleep. For such a person, we want to explore the basic things. And these things are, trying to sleep, try to use light clothing. And when we say light clothing, things like cotton fabric that could breathe, the skin could breathe through. We want to encourage exercise. Studies have shown that women who are more into exercises, like aerobic exercise, dancing, swimming, walking, brisk walking, for example, such people tend to have reduced symptoms compared to others. And then we ask that you keep quite a cool room. Let your room have a good airflow. Okay, that would help. And try to relieve stress. So breathing exercise is a way to take off stress. That could help with the flush. Another thing that people do not really take into consideration are the type of meals that we eat. So something like caffeine from tea or coffee, or if you're the one that loves spicy meals, such things could really aggravate these hot flushes. So if you could cut things down in that way, then you could also help to bring down the hot flushes, the night sweats, and all of those bits that comes with the vasomotor symptoms. Having said all of this, the rest things, when I talked about headache, irritability, low mood, and all of that, we could actually address these things with non-hormonal treatments. There are a few that is actually not licensed for this, but studies have shown that they could be helpful. And these are a set of antidepressants, okay? You could speak to your doctor about it. They are SSRIs or SNRIs antidepressants, which studies have shown that when you use them, they tend to help with these vasomotor symptoms, the hot flushes, the sweats, and all of that. They also help with the mood swing, right? The irritability, and it did. And from all the findings, if it's gonna help, you would notice the improvement within a few weeks of using this medication. Some people have also, the guidelines also mention, right, the use of a medication called gabapentin. Now, this we normally would use for pain relief and for pain relief mainly, but again, women using this have displayed, have responded well to with this gabapentin for hot flushes. Back then, a few years back, I would have been mentioning something like clonidine, but right now there's no good evidence that clonidine does help, and so it's not been encouraged lately. For all these medications I have mentioned, they do have their side effects, and one big side effect that makes people not want to really try it is that there is a loss of sex drive, so loss of libido. Another side effect is the GI side effects, which will come with abdominal cramps, dry mouth, and some people tend to yawn often. So they are not side effects that you cannot cope with, right? So if you think that these are the symptoms that you're struggling with, I would recommend that you speak to your doctor and see if you'll be one of the few that would benefit from it. We have talked about lifestyle changes, and we have also talked about non-hormonal medications that could help. The other ones are hormonal medication, and this is the well-known HRT, hormone replacement therapy. Again, like I mentioned earlier, treatment is really focused on that problem that bothers you most. So for example, if it's vaginal dryness, you might try simple moisturizer, right? And best to try the water-based vaginal moisturizers, because they tend to last longer, unlike the ones that's got alcohol in it that would evaporate and go dry. So you want to try a water-based moisturizer. If it's not helping, then you could try a HRT vaginal cream. It's very helpful, and it works just in that localized area, and so the side effect is less. So we have taken that aspect out. So what about the other aspect? The whole vasomotor symptoms and all of that. If all that we have mentioned so far, you've tried it and you don't like, it hasn't helped you, then you could try a HRT, hormone replacement therapy. They come in different forms. We have the combined ones and we have the single hormone one, okay, which is just the estrogen one. Now, we are careful in giving this hormone replacement therapy to women who have gone through problems like breast cancer, or who have family history of breast cancer, or endometrial cancer, okay, a small percentage of ovarian cancer, also people who have suffered from blood clots, for example, or migraine. So there are a few cases that we would want to consider, but in the long run, it is very well tolerated. There are side effects as well, and these side effects range from blood clot to having things like the cancers like we mentioned. But from every study that has been done, you know, if using it for a short time, right, the risk is less. And also when you stop using this hormone replacement therapy, you know, stop the based on the duration. For example, if you stopped it for 5 years, then the risk goes back to zero, like you never used it at all. So it is worth considering, and it's worth talking to your doctor to see if, you know, what works for you. Okay. Finally, I think the one that the most you know, there's a lot of controversies out there, and some people have gone through the use of complementary and alternative treatments. And JO to the power of 2, I hope you're listening. You did ask a question regarding these alternative treatment options. Well, from you know, from my own training and, you know, guidelines I'm so obliged to, we do not really recommend these forms of treatment, and that is because it has not shown convincingly that it works. Okay, some women have used them and they have benefited from them, but I guess the fear is that it's a lot of this product out there, and so there isn't the quality of the product cannot really be controlled, and because you have various manufacturers out there. So this is one aspect. And then the other thing is that some of them contain similar product like estrogen, and therefore for such women who cannot use estrogen, for example, you know, in HRT, they cannot use these alternative forms of treatment as well, because then they are exposed to the risk of breast cancer, endometrial cancer, you know. So the risk is as it is with HRT, and the fact that there isn't any, you know, you're not sure how much. So how much would you use, and for how long would you use it to know that is effective? Like I mentioned to you with HRT, when you stop it, at least in 5 years after stopping it, your risk of using it's, you know, 5 years of stopping it is as good as not using it at all. But for these alternative treatments, there isn't any guide. There hasn't been studies to show how safe it is, how long do you have to use it, and when you stop using it, when does your, you know, when do you really go back to your, you know, to your pre-normal state. I've also got to know about these things is that for some of them interact with certain medications, okay? For example, someone on blood thinners, warfarin, if you use, some of them interact and would actually make these, interact with this medication and cause the effects of warfarin to be much more exaggerated than expected. Other side effects includes liver damage. So I would always encourage you that if you want to use any of these complementary or alternative forms of treatment, you've got to read through the label. Take it to your doctor and let your doctor go through it and have a good chat with you about it. And so a question that has just popped to mind now is, you might be wondering, how long do you use this treatment? So basically, the symptoms, so some people will go through menopause without needing medication anyway. So usually it depends on when did you get, when did your menopause start. If you are one of them having what we call premature menopause, so you're having it in your 30s or in your early 40s, then you definitely will benefit from a HRT, because you need this to maintain the quality of your bones, and the rest things, right? But if you were attaining menopause at 50, for example, then you could use it for 5-7 years and then stop, and things go back to normal. I think it all depends on individuals and how you can carry things through. But in the long run, for every woman, I would always encourage us to a few things: exercise and diet. As a woman, you need your vitamin D and you need your calcium. And for calcium, would encourage you calcium of 1,000 milligram in a day, and you could easily get that. You could get it from milk, from cheese, from yogurt, from sardine, things like that will give you this 1,000 milligram of calcium I've talked about. And then you need vitamin D. Just a tiny 10 micrograms will take you through. This is what you need to maintain the integrity of your bone, right? For those of you who take alcohol, try and cut it down. The recommended weekly unit for women, as you know, is 12 units. So try not to take more than 12 units in a week. For those of you who smoke, smoking cessation advice is always what you get from a doctor, nothing less, because really smoking takes you nowhere. There are loads of side effects and loads of problems that come with smoking. I hope I've been able to talk you through the treatment and the how to deal and live with menopause. I look forward to your questions and I look forward to your suggestion. Until then, see you next Saturday. Bye, people.